Good morning. Good morning. Good morning. Every time I hear that intro, that beat it just kills me. Welcome. Jason Wallace, Hidden Figures Behind the Numbers with the Restaurant Scientist podcast. I want to thank you. I want to thank my sponsors, Cornerstone Business Labs, Cornerstone Productions, and Cornerstone Media. Without them, none of this gets paid for. So obviously we have to thank them. Today, I'm honored to have as a guest Sharon Cox of Cox Duncan Network. Sharon is a clinical dietitian, has a plethora of experience in the nutritional space, and we're honored and welcome to have Sharon here. Sharon, welcome to the show.
Thank you, Jason. It's a great pleasure to be here. You know, we've talked for many years about coming together, doing something, and I'm happy we have a chance to talk. But I'm going to hold you to something. At the end of this presentation or discussion, we're going to have to do something together to advance our profession. And so I'm hoping that throughout this discussion, we'll come up with something that we can do together. How about that?
Okay. No, absolutely. Without a doubt. You're absolutely right. I mean, you're a phenomenal person professionally. You've been out here in this industry. You have you got to tell me what some of these acronyms or abbreviations are after your name: MA, RDN, LDN, FAND.
Okay, well, in our profession, certainly the MA stands for the master's degree, which I have from NYU, and I'm a New Yorker born and raised, as well as a registered dietitian. RD stands for registered dietitian. I'm licensed in the state of North Carolina. So that's where the LDN comes in. And then FAN, I'm a fellow of the Academy of Nutrition and Dietetics.
So to my listeners out there, I told you, we bring the best and brightest the food service and African-American Black food service professionals has to offer here to my podcast. So Sharon, let's just dive into, give us a little background about you both educationally and professionally.
And Jason, you don't mind, but I just want to frame the conversation about, why do we need to have more Black professionals in our industry, and why is it so important now? Because I think back a few months ago when I spoke in virtually, but part of the Congressional Black Caucus Health Trust, and we looked at health and nutrition disparities. And certainly we know that COVID has hit our communities harder than any other communities. And yes, it's about behind, behaviors, diet and exercise, but it's also social determinants of health. And what we talked about was, we went back to what Shirley Chisholm said in 1970 about health, is a human right and not a privilege to be purchased. And what can we do to support this human right in our industry? Why do we need Black professionals in our community talking about food, teaching people how to cook? Why do we need to educate them? And so it really helped me to think about my career and why I'm in the business. And this is important for me to give back, because the reason I got into the business was to actually give back to our community.
And educationally, where did it all begin for you?
Well, I want to shout out to my New York friends. I'm a New Yorker born and raised, and I always highlight the Sugar Hill district of Harlem. That's where I'm from.
Okay.
And went to the High School of Performing Arts. And so I never thought that I was going to be in this field. But it really started for me with a volunteer experience at the Bronx VA and having to work with spinal cord injury patients and seeing the transformative power of food and nutrition, their needs for protein, for wound healing, fruits and vegetables for infections to control those, just weight control so they could actually move from their bed to their chair easily.
Right.
And so that experience really helped me to decide that I could really help the community about teaching good nutrition. So it started there with that experience. And I was a member of many different groups, and I could have gone to Howard University, but I did stay in New York, and I went to the City University of New York, first at Hunter College,
Okay.
and later graduated from Lehman College with a BS degree in nutrition. Went on to get a internship in Chicago. So I lived in Chicago for a few years and I did a VA internship. And it was a paid internship. And that's very rare. We're trying to get that back because that would help some of our young professionals, especially those of color, to get into the field. But I had a paid internship, food, room, board, everything, and I could really learn without the hardship of thinking, how is this going to be paid? And I came back and the obligation was to work for the VA. And so I went back to the Bronx VA and started as a clinical dietitian. And there I was fortunate enough to have my master's degree paid for, and I graduated with an MA from NYU. And that was a phenomenal experience. And so I really got my master's early in my career. And at that time, they were not pushing the MBA degree. But now a lot of professionals, especially those who have gone into the food service aspect of hospitals, are seeking more of an MBA more so than a master's. Mine was in public health.
Okay.
And certainly that helps me now in my business. But the business aspect, I call on you all the time when I have finance questions. And so that's a strength that I'm building later in my career, but that wasn't a strength early in my career.
So just so that we can put a visual to some of my listeners, give me an idea of what time period was this? What was the appetite for the community and the nation at this point in reference to how we thought about food and nutrition and culinary arts or restaurants or, shopping even at home? Just walk me through that at that time when you were being exposed to this, because I'm assuming you didn't see many Blacks or Latinos or even females in these positions.
Well, first, I want to emphasize the importance of volunteering.
Okay.
Having a sponsor.
Mm-hmm.
I was very fortunate from early on in my career that I had a sponsor. And when I did work at the VA, and that's how I did a VA internship, I lived in the Bronx. And I lived in the Bronx, I would say from the mid 80s until maybe 1993. And what we see now is what we have seen for many years, that we didn't have a lot of grocery stores and access to fresh foods. People were getting their meals at, fast food restaurants. Some gas stations were the primary place. And the VA, believe it or not, was ahead of their time as far as how are we going to not only feed the veterans when they're at home, but how can we work towards prevention? Gotcha. And so in the mid 80s, prevention at the VA was a focal area. And my sponsor, and her name is Robbie Graham, I won't forget her, she was an RD and she was an African-American woman, said, Sharon, we need more African-Americans in this field to first teach nutrition. But what we know now that people weren't talking about is, yeah, you can tell people what to eat, but if it's not accessible or they're food insecure, our message is not critical at all. we need to ensure some of those other social determinants are actually addressed.
Okay.
And so when I came back from my internship in Chicago, I was a clinical dietitian for maybe 2 years, but I was asked then to move into an administrative role in food service.
Okay.
And this is when I can give you a little history. For dietitians, the administrative side in the 80s wasn't frowned on, but it wasn't too many people in that area. I think I was selected because in food service, traditionally, we have many people of color in cooking and delivering food.
Mm-hmm.
And so they thought were more relatable to that group of individuals. And I was targeted for the job. Not knowing for me personally that this was the opportunity for me to build my career. Because when we talk about dollars and economics behind clinical nutrition and food service, two different pathways. I mean, you can be a clinical dietitian and it's a great career, but the opportunities with regards to salary growth is much more on the food service side. And so as a food service administrator, we were doing menu planning back then in the 80s, as well as nutrient analysis using a calculator. So it was no computer. And that's exactly what we did, which prepared me to be one of the first to move into an administrative role at Columbia Presbyterian in New York and their first cook chill system.
Wow.
So that was an experience, and we were able to feed so much more of the community because we're still talking about that small footprint, mainly in the Bronx, and then expanding into lower Manhattan. And that's where I worked for probably 10 years, working in that venue.
Got you. Yeah. So for my listeners out there, she's speaking about the food service track, which is a actual, in the hospitals, cooking and serving and planning those meals versus the dietitian track. Any idea what those salaries were at that point? The difference?
If you're talking in late 80s, dietitians were about 45,000, 50,000 coming out of school. And I'm talking, you have to be in most hospitals a registered dietitian. Yes. And so that's where we've seen the difference with in our communities, where there's a lot of individuals of color have gone through the bachelor's program. But when it comes time to either having an internship, because it's not paid for normally, or getting a graduate degree, those are some of the pathways to become registered dietitians, they fall short. Okay. And so most hospitals around the country require a registered dietitian. So those salaries are around, 45,000 to today, you're looking at an average salary of 65,000 maybe.
Got you.
So we've seen a small climb, but not a big climb for clinical dietitians.
Particularly if you're living in the tri-state New York market, which is where we shoot our show. That's not enough to pay your rent.
Right. Even though, if you look at the stats, this is a field that's going to grow tremendously. And obviously so. I mean, with chronic disease, just growing, COVID, and the need for people to build their immune systems, understanding the nutrients behind that, it's a field that is wide open and needs lots of people in there. And again, stats will tell you that people really change their behavior based on, others talking to them that have had similar experiences. Absolutely. So experiences, again, helps you develop your beliefs and perspectives, and those change your behavior. So we realize that African Americans sharing their experience with other African Americans or people of color really helps to change behavior. And so that's another why behind why do we need more in our industry.
tell us a little bit about your work and you're doing currently, and also wrap in there public policy. Explain and educate us on how legislation and political policies that are being developed and implemented and historically have been developed and implemented positively and negatively impact, our communities, Black and brown communities, and food insecurities.
And, I skipped a few things, but obviously from that clinical to administrative, I want to circle back to how Memorial Sloan Kettering, being the director there, changed my life. And so hold that thought. I'm going to answer your question. I'm currently a board member of the Academy of Nutrition and Dietetics, and we're 100,000 members strong. I mentioned to you earlier, about 2.6% African American, about the same for Latinos. And so we realize that we have a lot of work that needs to be done.
2.6% of what number?
About 100,000 members.
What absolute value? Wow. Okay.
Yeah. So that's a very small number of individuals working in the industry.
Yeah.
I would say since I left Memorial Sloan Kettering, I do have a colleague that works there now, Dr. Veronica McClymount. She's been there 20 years. She's an RD. I do have another colleague at MD Anderson running the food service department, but there's not too many of us out there that are RDNs working in food service and making a difference. But I was fortunate to be elected to the board. It's a 19-member board. And when we think about nutrition equity, and that's really our mission, to ensure that people across our country, globally, have access to fresh food and clean water. It's on so many levels that we have to work. And we look at it through an ecological, social model that we have to start with us as the individual, all the way up to the policy. And so when I think about my work in policy and advocacy, that was never in the forefront in the 90s. And it really wasn't in the forefront when I worked at Memorial Sloan Kettering in the early 2000s. But now it's one of the largest parts of what I do on a volunteer basis, as well as my business.
Gotcha.
And the reason is that we really advocate for those policies that really support food insecurity. So with SNAP and WIC, most of the dietitians that work in those programs are really helping those communities access food. And you see on TV now the food banks, the food pantries, and what people are doing.
Right.
At the forefront of most of those programs, you have a dietitian coordinating those efforts and helping people to understand, how to protect that food. Sometimes I'm looking on TV and I see how the food is distributed, and I'm saying, okay, I'm a serve safe
time and temperature
and proctor. So I keep that serve safe hat on all the time.
Yes.
But are they holding the food at the right temperature? Are those foods within the good date to eat? All of those things. But we really advocate for those policies that ensure that those in need are not food insecure. And how do we get those dollars to them?
Yeah. No.
Also, we're looking at food accessibility, and we're working with a lot of faith-based organizations, sororities, fraternities, on what can we do in the community, from mobile food trucks to gardens, and all of those things really help with food accessibility. And it was interesting when Whole Food came to Harlem, and some of the grocery stores, and what it took to get a grocery store in the middle of Harlem. Around the country, our association as an individual, we're advocating for bringing wholesome foods to communities that are considered food deserts.
So yeah, it's funny you say that. Obviously, me being on the food service side and restaurant consulting, I see, even during this entire pandemic, when people are preparing foods and sending them to first responders and to hospitals, and I'm thinking, okay, we got 2 hours to get that food through the danger zone. When you start thinking about serve safe opportunities,
Right. Yeah.
For my listeners out there, serve safe basically. Our number one priority is making sure that the food is safe even before it tastes good. And, you either holding food hot, food being prepared cool, hot, and then brought through the danger zone down to chilled, or there's a time frame that, that food is just time and temperature abused. So that's when you see that, Sharon, I'm looking at the same thing sometimes, and I'm like, yeah, hopefully they're doing it correctly.
Right.
But so let's go back to, I know you said something about Memorial Sloan Kettering and changing your life, and really parlaying that over into policy. And do my listeners need to understand, or how do they get engaged at the local levels or at the national levels? Like, where's the need for one, educationally for my listeners, and then two, more importantly, from an advocacy point of view, how can we get more involved to help shape public policy, or is that just wishful thinking?
Well, for dietitians, certainly it's our association, the Academy of Nutrition,
Okay.
And Dietetics. The National Restaurant Association certainly has a lot of advocacy. So I would say to get involved normally is through your professional association first, but certainly there's a lot of grassroots efforts. I work with the American Heart Association, the American Cancer Association. So, and of course, the American Diabetes Association. All of those groups have strong advocacy programs. They need so many volunteers, and that's really a good way to get started.
In terms of behavior, actually having it trickle down to the individual. So if we can get to a point where we give them access to fresh fruits and vegetables and clean water, how difficult is it then to change the behavior, and what are the other resources that are required to actually have effective change for people in terms of how they're shopping, and then once they get it, how they're preparing the food, and does someone need to be a vegan? Like, I see these extremes. I'm a pretty fit guy. I want, when I want soul food, I want traditionally, unapologetically soul. Like, give me fat. You know what I mean? Give me what it is, and I'm going to monitor my intake, and I'm also going to exercise. So I'm the guy that's saying, well, I don't blame my food if I have health related issues that I can control with my diet. But I need to obviously have a balanced approach there. So hopefully you can educate me as well, and my listeners. Where's the middle ground there? I mean, soul food is not killing us as Black people. It's the amount of food that we intake on a regular. If we're eating 2 pounds of food, and obviously it has unnecessary things in it, then that's one thing. But if we could monitor that as well as balance it with a healthy lifestyle and things of that nature. So give me your professional clinical take on that subject.
Well, I'll go back to that statement earlier about how can you get people to change behaviors. And it's really the experience that drives your value and your perception that will change behavior. And so we always start with what's out there. And the guidelines for Americans is the dietary guidelines that the USDA puts out. And what we see is that, yes, there's been a lot of scientific studies done about what is considered a healthy diet. And so we all agree now that most of your plate should be, fruits and vegetables, at least a third, and maybe a third of protein. And then you're looking at, the high fibers, the diet, dairy, and all the other products. And so, how do we interpret that to communities of color? And what we found is that with the dietary guidelines, we're looking at a European plate, and it doesn't really have a lot of the foods that we commonly use in our communities. And what we've been teaching is, if you think of the soul food diet, a lot of the soul food diet early on had to do with fresh fruits and vegetables and those greens that we grew and how to use that. Just thinking about the meat sources, that is where the rubber hits the road, where we're trying to come up with ways to make fruits and vegetables interesting to eat and educating people on decreasing their meat intake. And so the balance is really having more cooking demonstrations around the country. As a matter of fact, I've worked with, I met you a few years ago at Miss by chance. And I also did something with Chocolat in Harlem a few months ago, where we looked at how can you prepare food healthy, what are the fresh ingredients, what's considered those ingredients that builds your immune system. And so giving people a different experience of foods that are familiar to them, but how do you prep them in a way that's healthy, gives them an alternative.
Gotcha.
And so we try to develop meal plans with foods that are familiar, but have that same basic plate where you have a third of fruit and vegetables, a third of protein, and then you mix in your starches and your dairy. Also, we're really emphasizing fat intake and what is considered good fat intake. The olive oils, we're certainly pushing, and stressing water. Still, water is key, and really eliminating those sugary drinks.
Beverages, those uptowns and that Southern iced tea and lemonade. Absolutely.
But I want to emphasize that I certainly was a clinical dietitian, but when I say that Memorial Sloan Kettering changed my life, is that I understood at that point where the science and nutrition intersect with the art of, culinary preparation. And I was one of the first, as a director at Memorial Sloan Kettering, to actually hire CIA chefs. We actually had two during my tenure. We had Johnson and Wales chefs, and that was just the beginning in the early 2000s of having the culinarians, as we say, in the kitchen and actually presenting food, because hospital food has a bad reputation.
Right.
Presenting it in a way where people not only receive the nutrients needed, but they enjoyed the experience.
Right, yeah.
And it changed my life because, one, the notoriety of Sloan Kettering and being one of the first with a room service program, we actually received recognition through food management. And I have that cover shot from years back, being on the cover of Food Management. And also several articles within the New York Times about the changing face of food service and the importance of providing the nutrients, but making sure the food was flavorful and presented in a wonderful way. And my experience came from visiting the Waldorf Astoria Hotel, all the fine restaurants. We actually created a preparation it was called the Waldorf Suite. So we designed our kitchen at Memorial Sloan Kettering and put a Waldorf Suite right in the center to help us get that room service program out.
Wow.
So that's when I started to learn more about kitchens. And since then, I've probably built about 30 kitchens, believe it or not, and actually consult on how to put together a room service program, how to do menu planning, again, with the emphasis on presentation and style for hospital patients.
Well, congratulations on that, and we thank you for your trailblazing efforts. Let's pivot. Let's utilize that as a pivot. So let's talk a little bit about entrepreneurial opportunities within this space. Talk to me about the Cox Duncan Network and how you've been able to create a business, entrepreneurial business for yourself and others. And then let's go into a post-COVID environment of where there might be opportunities entrepreneurially for Blacks in food service.
Cox Duncan, we've been in business now for 3 years. And again, my last experience as a assistant vice president at Atrium Health, I was very much involved in their expansion of new facilities, and probably during that tenure, actually built about 12 kitchens. Okay. And so my experience in project management and understanding how to do the menu planning and actually designing the kitchen was something that I built on as an entrepreneur. So certainly our core strength is around tools and resources for healthcare food service and helping with kitchen design. But also we're really focused on menu planning and nutrient analysis and allergens. And that's key in healthcare, understanding what ingredients are in the food and how to ensure food safety with your patients. Wow. And that's not something that a lot of people have as an expertise. And so they value that within Cox Duncan. So that's one. Secondly, we talked about food safety. And so my partner and I are both Serve Safe instructors as well as proctors. And there's a need on the restaurant level, in corporate kitchens and healthcare to actually teach groups, and we can do that virtually now, food safety. And that's been a core business of ours.
Got you.
But what I have enjoyed is, again, working with individual restaurants, such as Mist, a Chocolat, and I've worked with several restaurants here in Charlotte. And the focus really has been around customer service. And that is another area that we've learned so much about from our healthcare experience. Because as you realize, reimbursement in healthcare has a lot to do with the customer experience. And that could be anything from food to nursing care to dealing with pain. And so some of the ways to measure customer service is probably unique to healthcare, but definitely transferable to restaurants, in any other organization. So that's another thing that we've done well. And then lastly, when I think about pre-COVID, we did just a few lectures across the country with regards to nutrition equity and finding your place. Where can you make a difference in your community? That was probably just a small percentage of what we did. Now we're partnering with quite a number of individuals, especially dietitians, talking about what can be done to really accelerate nutrition equity. Right. And we're working with a group first to develop a cultural competency and cultural humility tool. Because if we understand clearly, if there's not a lot of us in those communities, right, how can we train individuals that work in the communities of color to be culturally competent? And it really drives home the biases, the implicit biases, and what to look for. And also, the assessment allows us to think beyond just telling people what to eat, but understanding some of those social determinants,
Right.
such as, education, understanding income, the environment they live in. And so that has really been a post-COVID focus of ours versus what it was before COVID.
Got you.
And then lastly, I would say certainly lecturing and talking to those organizations. I also work with a consulting group with associations around the country. And associations are small communities where people come together to do good. And I found that my work in association management has been very valuable, working together with individuals that want to make a difference, but really helping them to understand their focus area. Because we all want to do something, but we can't do everything.
Right.
And understanding your company's strategic position and capacity has been something that I do within the association community.
Got you. So Sharon, I can see where the larger companies are the hospitals and things of that are your target market, but for independent restaurants, in terms of being able to need your services is one thing, but afford your services is another thing. Do you also help them or bring sponsorships or funding from larger corporations to offset the cost for independent operators? Or is your target market more multiple unit operators, those mid-level, 5 to 15 unit restaurateurs?
Well, it's interesting, and I'll just give you an example instead of answering that direct. And working with my brother, Team Unity, not-for-profit organization. When a small group or restaurant comes on board and is part of our team, when we receive a grant. And so those organizations like my brother Team Unity, and I'm working with a group of diversified dietetics, when we look for grants with regards to how to improve things in our community that will address nutrition equity, it normally touches the restaurants. Like we worked with Melba and Chocolat. They were doing food deliveries to the community, some to healthcare workers, but some to individuals. And so those grants and those opportunities to work with the not-for-profit, that has been the bridge that we built to help individual restaurants. And in many cases have been very successful.
So Sharon, let's segue and pivot over into some of the things you're doing and want to discuss in reference to leadership training and salaries and the current state of Blacks in food service.
So when I think back, we talked about volunteering and having a mentor or a sponsor. But for me, I think back to experience in early 2000 where I had a sponsor to attend the Executive Leadership Corporation training program. And that's still going on now. And I think your listeners should really check it out. And it's a group of executives from top 500 corporations that come together to mentor young African-American professionals. And during my tenure was a 1-year program. I had an opportunity to work with Ken Chenault at American Express, Ursula Burns at Xerox. We did projects. And that really helped me understand how to break, like they said, the corporate ladder or crack that corporate code.
Yeah.
I don't know if you heard of Price Cobbs and some of his work, but food service and our industry is still a business. We may not think about it all the time in a corporate, but many of your listeners do work in corporate, and we really need to know how to navigate to get to the next position. And certainly that experience, inspired me to move forward to leave Memorial Sloan Kettering after 10 years and to expand my horizons. So going from a director's position, I would say that certainly being in New York and being a food service director, it's a six-figure salary, low six figures, but it is a six-figure salary.
Right.
But to move on I moved to Memorial Hermann in Houston, where I managed 3 facilities and 5 kitchens within that.
Mm-hmm.
And I don't know if you're familiar with the Texas Medical Center, but one of the largest in the country. Its salary went up 20%.
Wow.
And then going here to Charlotte, being an AVP, I managed 2,200 employees, about a $75 million budget. And again, the opportunity to build about 10 kitchens during a small time frame. I came at the right time when there was growth. And again, those salaries and the bonuses that you get as a result of working in those projects was not something that I could see working at Sloan Kettering. Again, it was a great experience at Sloan Kettering,
right.
But the ELC gave me the vision of what else is out there. And it also inspired me to be an entrepreneur. And I do think that when people want to be entrepreneurs, it's okay to have a parallel pathway. Because I do 2 things. I have my own business, and then I work as a senior consultant with Tecker. And that also gives me an opportunity to learn more about other organizations. So I've worked with the school board, National School Board. I've worked with FBI and Tennis Bureau Investigation. I've worked with the Association of Design, Bar Association. And so you can imagine the learning experience that you get working with those associations, being able to bring it back to your own business and create tools for others has been tremendous.
So in going forward, Sharon, where do we attack this thing? I mean, I know we normally fight things on multiple fronts. Do we need to, when I say attack, I know you mentioned a number earlier, 2.6%. And then now you're sharing opportunities. Do we need to get into the colleges? What do you need from me? Like, all right, so let me forget about, let me be very personal about what do you need from me and people like me to help get the word out to the next generation of dietitians and professionals to say, okay, here are these opportunities. Here's how do you get access to people like yourself, mentorship, network opportunities, and going forward so that in 2025, that 2.6 number is at least, is 4%, 5%, 10%, whatever the case may be.
So we are within the academy and within a small group of African-American dietitians are putting together a brochure about the career. Okay. Why it's important and what is needed to come to be a registered dietitian.
Gotcha.
So on our end, that's what we're doing. What I think, and we haven't talked a lot about it, is that multi-career path. I'm seeing quite a number of registered dietitians that are chefs. And nutrition is being taught now at CIA and Johnson & Wales. What we need to do is demonstrate the importance of bringing these 2 groups together. Go back to what I said earlier with, yes, you need to understand the nutrients within the food, but you need to prepare the food where people actually consume it.
Right.
And so when I always talk to you about partnerships, we're talking about how do we bring like-minded professionals who had a good career in the industry to mentor others. Gotcha. Because for me, my experience and my growth has been on the backs of those who have brought me forward. And that's what I think we need to do.
Absolutely.
The forum, we have to talk about it, but certainly we're in a position to mentor to others.
Do we start in high school or college?
Oh, definitely high school.
High school.
Definitely high school. And you can even see, I know some of your previous guests talked about Food Network, but you're seeing that young people are enjoying cooking.
Yeah.
And just being able to put food together in a most, for people to enjoy.
Absolutely.
And now they need to understand the importance of those nutrients and bringing it all together. What a great career. Yeah. And we didn't talk about sustainability, but within the food system, we need to understand sustainability and what we should be doing and should not be doing to ensure that we have a sustainable environment in years to come. Gotcha. So I think that Healthy People 2030 is like a backdrop, and young people want to be involved in things that will make a difference in their lifetime. And so coupled with mentorship, for us to have a goal of working towards this Healthy People 2030 would be the start.
Wow, a lot of great information and knowledge there, Sharon. Is there anything else we missed that we want to touch on before we wrap up?
No. I would say I've enjoyed volunteering. I want to emphasize that again. In the 2000, and that's where I met Alex, I was president of the Association of Healthcare Food Service. And that demonstrated the importance of bringing communities together. Alex and I, at the same time, we received honorary doctorates in food service from IFMA and some of my other colleagues. So I do want to emphasize, even at a young age, get involved, definitely volunteer. And when you can, those are the things that built my resume, being an associate president at a younger age, and now being on the board of the academy. Absolutely. So I do emphasize those things as being important to building your career.
Well, I'm an operationals guy. So if you ever, whatever you can need from me operationally, don't hesitate to give me a call. And I'm looking forward to continuing the dialogue and figuring out a way for us to actually work together in 2021 and beyond, because I think, as well as an entrepreneur, I think there's a lot of opportunities in a post-COVID world for advancement and growth economically. And, that's at the end of the day, to me, if we don't, resources are great, but if it doesn't trickle down to us economically, then, we're not at the table. We can't eat. No pun intended. Hell, pun intended.
I agree.
We gotta eat from this thing, from this industry that, again, I needed to create a platform for us to have these candid conversations, because we love the food service industry, and the industry truly hasn't always loved us back, just like America itself. So it's again, I want to thank you for opening up your network, your information, your knowledge, to really share with my listeners about the current state of Blacks in food service. So
thank you, Jason. Look forward to working with you in 2021.
Much respect. Thank you. Let's drill down on, how does someone get in touch with you or Team Unity, or, who's the contact here, and how do my listeners across the country get access to you?
Well, for Cox Duncan Network, I'm one of the founders and co-owners. So that's Sharon.Cox at coxduncannetwork.com. And so even if you just go to the website, www.coxduncannetwork.com, you'll see myself and my business partner, Crystal Duncan. And there is a tab that you can reach out and contact us. But certainly I would love your listeners, if they're interested in knowing more, to reach out to me directly.
And as we wind down, any last anything you want to put out there in terms of your business or career opportunities, mentoring opportunities, food insecurities? Like, what's the last word you want to leave my listeners with?
I think the last word is that we have a great opportunity now. Now is the time to make a difference in our profession, because we need more people of color in our profession, the nutrition profession, the food service profession. But why is it important? Is that our communities are being hit hard, and the services that we bring really will make a difference. And it's just so much more to look forward to with regards to having a healthier life. With a healthy life, like Shirley Chisholm said, it's a human right, and we want to make sure that everyone has that human right.
Well said. Sharon, you know I'm a huge fan of yours, and I think you're awesome. And, I just want to thank you for taking the time to be on my podcast, Hidden Figures. For my listeners out there, definitely go to Sharon's website, Cox Duncan Network. Sharon Cox, she's a phenomenal professional, very extremely knowledgeable, and just all around, good sister. So Sharon, I thank you again. And yes.
Thank you.
And as we wrap up today's show, again, I'd like to thank my sponsors, Cornerstone Business Labs, Cornerstone Media, and Cornerstone Productions. Until we meet again, power to the people.